SARS, MERS, SARS-CoV-2, West Nile Virus, Zika, Marburg, Ebola, and more. We are constantly under attack from the world around us, and these threats are increasing due to a mix of climate change, population growth, and the ability to hop on a plane and go anywhere around the globe in a matter of hours. Here at the University of Kansas Health System, we have been preparing for potential outbreaks even before the COVID-19 pandemic. Today we're going to show you just a little bit of our prep work as well. Good morning and welcome to Open Mics with Dr. Stites. I'm Dr. Dana Hawkinson, filling in for Dr. Stites this week. We'll get to that tease in a moment, but first, the heat. We are sweltering through a record number of days in the 100-degree and higher range, and that causes problems for people of all ages, especially children. With us right now is Dr. Sean Sood, a pediatric critical care specialist here at the University of Kansas Health System. Dr. Sood, thank you. And are you seeing any children with heat problems in the hospital?
Dr. Hawkinson, thanks for having me on this morning. You know, high temperatures and extreme heat can cause children to become very sick very quickly. It can cause dehydration, heat exhaustion, heat cramps, and heat stroke, which is a medical emergency. Every year at the University of Kansas Health System, we'll see 1 or 2 patients with heat exhaustion or heat stroke.
So what can we do for infants and kids in a heat wave like this?
Yeah, I think 3 things off the bat. Number 1 is prevention. Limit outdoor times during the hottest hours. Number 2, look for ways to cool down. Take your child to an air-conditioned place like a library or the mall. Take a cool bath or go for a swim. And number 3, dark clothes attract heat, so dress your children in lightweight and light-colored clothing. Those are 3 tips I can think of off the bat.
And also, most schools are back in session now or will be very soon, and many dismissed early this week and are keeping the kids in at recess. Can schools be doing anything else?
You know, this summer has been really hot, and I think we need to be prepared for more summers like this ahead. So a school system should really look into something called the heat index. The heat index is the effective temperature outside. And if the heat index is 95 or greater, protocols and guidelines should be in place in the school system. Some of those things schools can do is focus more in activities inside a gymnasium, like dancing and games. Number 2, if students are to be allowed outside, make sure they have free access to fluids and have frequent breaks as well to stay hydrated. And number 3, just making sure all the teachers and children know the signs and symptoms of heat exhaustion before it can transcend into heat stroke.
Yeah. And what about student athletes? Should they be outside after school, which is usually the hottest part of the day? And what should coaches be doing?
Yeah, you know, this is definitely a vulnerable population. Heat stroke is the 3rd leading cause of death in high school athletes. There are physiological differences between young student athletes and professional athletes that are adults. Number 1, they have a much reduced sweating capacity than adults do. Number 2, they have a higher metabolic demand and produce higher heat. And number 3, they acclimate to heat much slower than adults do. So coaches can do a lot of things. Number 1, don't practice on peak hours, 11 a.m. to 3 p.m. Number 2, if you're a football player and have bulky equipment, make sure you take that off during practices. Number 3, also pay attention to those athletes that are more vulnerable to heat exhaustion or heat stroke, those with asthma or obesity or sweat less. And number 4, always, always, always have access to free water, especially salty sports drinks. Ultimately, prevention's the key during this really, really hot summer.
Yeah, I don't think we can talk about prevention enough in all aspects. So, Dr. Sean Sood, thank you, one of our expert physicians here. Thank you for coming in this morning, and stay cool and stay healthy out there.
You too.
All right, well, back to the topic that we are talking about today. Take a look at this timeline. This is showing all the emerging infectious diseases since 2003. There are 60 of them just in the past 20 years. Some are brand new, like SARS-CoV-2. Others are not new, but are appearing different areas or different corners of the world and re-emerging. Today we're talking about what happens when a patient arrives at our hospital and we think they might have one of these emerging or re-emerging diseases. Here in the studio are two of the nurses working with me in the Infection Prevention and Control Team, or IPAC for short, Tanya McIntosh and Annie Huber. Good morning to you both.
Good morning.
Thank you. We are also excited to get a demonstration from three other IPAC nurses, Maggie Rivas, Casey Christini, and Jordan Harvey, over in the School of Nursing. Recently, all these nurses helped train other staff on how to respond to a highly infectious disease like Ebola. That includes using the highest level PPE we have in the health system. Today we're going to see Jordan get into one of those hazmat suits with the help of Maggie and Casey. Maggie, start us off by describing all of the gear and the pieces of PPE that you have out there.
Absolutely. We will be getting Jordan into a full getup. We have a biosafety suit, a bioprotective suit. We have a capper, which is a type of PAPR or respirator. We have a hood that goes along with that. We have shoe covers here to cover her feet outside the suit, and then 2 pairs of gloves. So we have extra long nitrile gloves that are will be secured to the suit, and then the regular gloves that will go on top of that.
All right. And Casey, talk to us more about that PAPR, a powered air purifying respirator.
Yeah, so the PAPR is just, it filters airborne particles that gives good air to the healthcare worker while they are in the suit. And then it's broken up into a few different pieces, but the first part is the hood. This is what covers the healthcare worker's face, and it has the face shield on there. And then there is the helmet. This goes on top of the head. And then there's the belt and the battery pack. And they also have a communication device, which we can talk to them and they can talk to us.
Yeah, I think that communication is going to be key in there for sure. And Jordan, how are you feeling? Ready to get into the suit?
I'm feeling really good. I'm ready to show you guys and put the suit on for you guys.
All right, and I think it'll be great for our audience to see that. All right, Maggie and Casey, what are the first steps to getting into that PPE?
Absolutely. So normally when we get someone into this Tier 1 PPE is what we call it. It's our highest level of protection for our healthcare staff. We have someone who is reading a checklist, which is the role I will be playing today, and making sure that we don't miss any steps, that our communication is really clear to the folks involved to ensure their safety and protection as they're putting on this PPE. And then Casey will be serving as our donning assistant and safety coach. So she will be watching all of these steps and making sure that her PPE is intact, there's no rips, there's no tears, it all fits properly, and also helping Jordan put on her PPE at certain parts. So that's what you'll see us do. You want to go ahead and get started?
Yeah, let's go.
Okay, perfect.
Yeah, and I think that's so important for the donning or the putting on of this this PPE for these particular situations and possible infections as well. And so we will let you guys continue, get ready, and we'll be watching
So
here.
Our first step is to lay hood and heavy loading filter on the counter, which we already do.
So as they are getting ready, we are going to be here in the studio and helping describe it as well as answer any of your questions. Tanya and Annie, you've both been in that PPE before. What is it like in that suit?
Yeah, so it is a really interesting experience. That's the only way to say it. The capper, as you saw, will go on the head and fully cover the nurse's head as they're in the suit. And then they'll wear that BPS suit as well, so their body will be fully covered and fully protected from any blood or body fluids that these patients may have. The suits are rated so that they don't allow blood and body fluids into them, and as you can imagine, they do get hot after a period of time, so we don't let our nurses wear them for very long and they rotate out. The capper itself, though, the PAPR, does blow air on the healthcare worker's face, so that does help keep you a little more cool as you are wearing it. And overall, I mean, the experience isn't bad. Overall, you get kind of comfortable in the suit, and the little air blowing and white noise of the suit is kind of soothing overall. So It's not a bad experience, but as you can imagine, they get hot, they get sweaty, so we don't only wear those for short periods of time.
Okay. And so also, PPE is just part of the picture. If an Ebola patient arrives, we activate certain protocols and procedures. And can you tell us about where we would start doing that and what those would be?
Yeah, so anytime a patient would present to our facility with concern for Ebola, we would immediately try to kind of sequester them away. We have plans and pathways in place for getting them up to a small isolated unit that we have that is set up specifically for the care of these patients. So it has some extra security features. It's been set up so that it makes our taking on and putting on and taking off of the PPE a little easier. And then also has lots of areas where we can really visualize the staff. So the rooms have glass doors, so you always have a nurse outside who can watch what the nurse is doing inside for any breaks or tears in their PPE. So this small unit is kind of specialized and set up in a way that we've been able to adapt it over the years as well.
Anything?
Nothing to add.
And so this was a special unit created for specifically like Ebola, but obviously we have kind of broadened that out as well.
Right.
Okay, so that is one of the procedures. So it's not only about PPE and the people, but it's also the areas in the hospital. So if there are multiple Ebola patients, are we staying in one suit, or are we changing suits in between patients? And who is really caring for these patients?
We would change suits between patients. So if we leave the room of an Ebola patient, we would change our suit and put on a new suit to go into the next room. One of the major risk factors when caring for an Ebola patient is contamination with any fluid or blood from the patient, as that contains the Ebola virus that causes disease. So we really want to make sure, as part of our donning and doffing procedures, that we're making sure that we are limiting the exposure to healthcare workers and exposure between patients, in case, you know, we do have a positive Ebola patient, but then the next patient in the room might have malaria and might not have Ebola as well. As far as the people that are caring for these patients, we do have a team made up of critical care nurses and emergency department nurses. But in the event that we do have more patients than what our team can staff, we do have just-in-time training available. So we'll put out a call to say who wants to help.
I think that's vitally important, is who is going to be helping to take care. So when we understand who is going to be doing it, how do we train or educate floor nurses and other staff for these types of scenarios?
Yeah, so as we talked about, we have a specialized team. However, we know that in the event of an actual patient, we're probably going to have to bulk up that team. So those nurses who are specially trained can also be our content experts and help us train others, as well as our emerging infectious disease leadership team, which is made up of several of the IPAC nurses, as well as an education specialist, and our clinical nurse specialist of the emergency department. So we have lots of additional hands on deck when training needs to occur, and we can have those extra people available for assistance and training. And as you can see, there's lots of fail-safes with the donning and doffing as well. We make sure that we have people who are just in charge of watching what is going on. So Maggie's role here, she's reading the checklist, but as we're doing the donning and doffing, she can also be those extra set of eyes. And same with Casey, as she is double checking anything that is going on, then she can make sure there's no rips, tears, things of that nature. And then with doffing, you can imagine taking all that PPE off is when you're at most risk. So that's when we really have careful eyes and planning on someone. And if anything occurs, we are really encouraging the healthcare workers to use infection prevention basics. Don't touch your hands that could be contaminated to your eyes, nose, or mouth. And follow those basic practices that we use all the time as well. So our nursing care ratio to the unit is actually 4 nurses to 1 patient. And that is because, as you'll see, this level of PPE is very intense. And so you can imagine they can't just go to the restroom when they need to. They have to take breaks. So our shifts in this PPE are no longer than 2 to 3 hours, 3 hours at the very max. And they have to take it all off, of course, so that takes a little extra time as well. So we have signals that we set up with the healthcare worker, we have communication devices that they wear. So if they need to get out of the PPE urgently, we can plan that ahead of time. If there are rips or tears that someone else notices, the healthcare worker gets immediately pulled from the space as well. And as you can imagine, it's mentally taxing as well to be in this PPE for an amount of time. We also don't want there to be inattention. And as I'd mentioned, you have kind of that white noise going on from the PAPR, so you can really only stay in it for a little period of time before you might start feeling the effects of getting kind of tired and sleepy and dehydrated. So every time they get out of the suit, they drink some water, eat a snack, and go to the restroom. So this happens every time they get out, every time they get in.
Yeah, so such a big part of not just care for the patient, but really preparing to care for the patient. Well, as we look at back out there, Maggie and Casey and Jordan, how is it going?
Going well. We're about done with our checklist. So she's already fully in the suit here, and we're getting ready for our last couple of steps.
It's looking good. So how would you grade Jordan's donning so far? Any hiccups or issues?
No, she's doing great. Lots of practice makes perfect.
And is there any one part of the donning of that tends to cause more problems than others?
The puffiness of the suit.
Yes, I'd say the puffiness of the suit. You probably saw as she was putting it on that the shoe covers over her feet will kind of puff up as you're putting it on, and so it makes it hard to put those extra shoe covers on. And also just making sure to get this part on correctly and comfortably, because as you're attaching it and pulling it back, you can move the healthcare worker's neck and head around. So making sure that everything is fit and snug and comfortable.
So Jordan, what is it like in there?
I feel pretty good. Can you hear me okay?
Yeah, it's great.
I feel pretty good. I've got a nice breeze blowing on me from this capper hood. You know, after a while, you're probably going to get a little hot, but you know, that's why we take those extra precautions for our staff, that we're limiting the time that they're in these suits to that 3 to 4 hour shift, making sure you're hydrating before and after. But right now I feel good. I'm pretty comfortable.
Perfect.
Well, you're looking good. Thank you so much for doing that. And so if you have questions, please ask them now. We are going to be able to use the chat on YouTube and Facebook. You can tweet us, I guess we're still saying tweet, or email the Medical News Network as well. So let's turn our attention to COVID for a moment. And this week's COVID count really remains unchanged, still under 10. As of Monday, we had 7 active cases inpatient here. We are watching the case counts increase at the national level. Although the percentages of change may be high, the actual numbers are certainly not as high as they have been in previous years, especially for those number of patients that require hospital level care. So what about headlines today? Well, we know our topic today is these emerging infections. Just a little bit about the headlines. We know that there continues to be other things going on, not just here locally, but around the world. So most notably, we know that there are a couple cases of Ebola that have popped up in the Congo. We are still waiting to hear more about those. Hopefully that will not develop into a large outbreak. There's also other hemorrhagic fevers like Ebola, things called Crimean Congo hemorrhagic fever or Marburg. Right now we know that there are cases of the Crimean Congo hemorrhagic fever that have been identified in places like Senegal and Pakistan. And what about locally in our nation? Well, certainly we've heard about locally acquired malaria, which we haven't seen in the United States in several decades. Most recently, there have been those Florida and Texas cases where people who had not traveled seemed to get malaria. We also know that most recently there has also been a case of locally acquired malaria in Maryland as well. And so I think those things just continue to show us that with everything going on and the confluence of factors, we are continuing to be at risk of these types of infections. And it's vitally important to do prevention as much as possible, most notably wearing your bug spray when you go out and trying to avoid getting bit by mosquitoes. So those are the most recent headlines about kind of emerging infectious diseases nationally and globally. And we just want to know, are there any reporter questions today? All right. So we know that many of you have questions. Let's head to Studio B with Alexis.
We have so many great questions, Dr. Hawkinson. I want to start with Jean Reardon. Jean wants to know, how is the PPE decontaminated or cleaned after you wear it?
Oh, that's a great question.
Yeah, that's a great question. So everything that we wear in the patient care room has to be handled in a specific way. The waste, anything generated from that patient room gets disposed of, so everything is single use only. And as we're going through, it's all about containing and decontaminating everything. So even as we bag up trash, we are wiping down those trash bags with bleach and making sure we double bag, and it gets taken to very specific locations. So there's an entire waste management plan around that as well, in the handling of this waste.
And what about the PAPRs themselves?
Yeah, that's a great question.
They're wiped down with bleach wipes. So any of our equipment, like the communication headsets, the PAPRs, anything that might go into the patient care room that could be reused, we wipe down with bleach wipes to make sure that it is thoroughly decontaminated. If it is not able to be decontaminated, if there's any kind of equipment that it would just be too hard to make sure that it is properly decontaminated for another patient, it is disposed of.
Joellen McGranahan has a great question. She wants to know, could you become claustrophobic wearing one of these suits? Does anyone ever get nervous or squeamish in there?
Yeah. So luckily we have the PAPRs throughout our health system. So it's not necessarily the first time a healthcare worker has worn it, but it is something we tell them as they're going to be wearing this. If you get claustrophobic, you probably shouldn't be caring for these patients and using that level of PPE, because yes, it gets a little tight in there after a while. So if you have problems with confined spaces, you may need to think about that.
Joellen has a follow-up. She wants to know exactly what defines a short period of time wearing these. Is it 5 minutes, 10 minutes? How long?
That's a good question.
Yeah, that's a great question. So we have, usually the healthcare workers, when they're training, they get in this PPE for an hour or so, because just donning and then taking it off again takes quite a bit of time. So they get lots of experience with it. And then we've also worn it for periods of time, even just in our office, to kind of get a sense of how long it's comfortable to wear. And again, if at any time the healthcare worker in the room is feeling uncomfortable, they have that communication headset to tell the people outside.
And Jordan, any feelings of claustrophobia or fatigue right now?
No, I feel really good.
Okay, well, that's good.
Yen Liang has a question. Yen would like to know, judging from the past and current data, is it possible to have a new pandemic with the progress of global warming?
It is always a risk, especially as we've seen with some of the new locally acquired malaria cases. As climate change progresses, there is always a risk for any vector-borne diseases, so like malaria or Zika, to spread into regions where it hasn't been seen before. As far as pandemics go, I'll defer that to Dr. Hawkinson.
Yeah, I mean, I think there's always that potential for a pandemic, most likely with things that we haven't identified yet. But of course, we're always closely watching things that we've identified. Certainly, we know that highly pathogenic avian influenza is out there and infecting and killing a lot of the wild bird population, but also the farm bird population. Luckily, we haven't seen that many human cases, and certainly no human-to-human transmission. But I think we always need to be continuing to do our surveillance and being monitored, because there is that potential there.
Pauline emailed us, and Pauline wants to know, how often do you practice with these suits?
Yeah, that's a great question. So we have that core team of nurses who practice at least quarterly. That is our goal, to make sure we're practicing quarterly. Every time we practice with them in the suits so that they can perform normal tasks and functions in them. Because as you can see, they're bulky, they're cumbersome. You have double layers of gloves, things that nursing staff don't normally have to worry about. So we want to make sure to properly practice those ahead of time and let them get a feel for that when we can. And then, every once in a while we have extra time that we do additional practices. And while our infection prevention team isn't necessarily the ones caring for those, we practice in the suits sometimes more regularly.
Orlando emailed us, and our viewer Orlando wants to know what happens if there are a lot of patients and not enough special negative pressure rooms.
That's a great question. So in the event that we do have enough patients in our special care unit that we would not be able to take any more patients, we would start collaborating with other area hospitals to see if they would have the capacity to care for these patients in a safe way. In the event that we do ever get an Ebola patient or a suspected patient, we would start immediately leadership collaborating with other area hospitals and other area hospitals in the region to see and have a contingency plan for if we do have so many patients that we cannot keep them at our assessment facility, transferring them to other facilities as well.
Jill has a really good question. Jill wants to know, what about the leprosy outbreak in Florida? Is it safe to travel there? Will it spread across the United States?
So we know that leprosy is, again, it's a very old disease. I think we've probably all heard about it or read about it in the Bible, and certainly seen other movies with it, Ben-Hur or whatever. But it's a very old disease. It is caused by a bacteria. We know that bacteria continues to be out there. One of the biggest reservoirs of that bacteria is just the common armadillo. I don't think there's a large uncontrolled outbreak, but I think it is important to understand that we are probably seeing more transmission of that and more cases of that. Certainly we know here at University of Kansas Health System, we see maybe a case a year, either from a traveler or somebody who's had risk factors, but right now I think it is very low risk for that to become a large uncontrolled outbreak or infection affecting a lot of people. But just understand that that reservoir is out there. We know the bacteria is out there, and we continue to monitor for it, and we do see cases from time to time. Certainly in the United States it is less of a problem as compared to some other countries, but it is something we need to continue to monitor and treat optimally so that we can get those patients cured of that.
Such an interesting behind-the-scenes look at something most people never get a chance to see. And Jean wants to know, how much does the paraphernalia for each suit cost?
That's a good question.
So I don't know the exact cost, but I do know that we have a set amount of suits that we have to keep stocked. So we do evaluate frequently how much we have, how much we need, and then we have in the past had contracts with various state health departments to help us fund that as well, to make sure that we have all the supplies that we need. So many of the items that we have come from some of that grant money.
Jordan, is there any price tag on that suit or discount value on there? Do you see any of that anywhere? Let's hope not. Let's hope we paid full price for this one. We don't want the discount, the bargain bin one. All right. Well, thank you so much, you guys. Let's wrap up with some final thoughts. We're going to start here in the studio. Annie, any final thoughts about Ebola preparedness?
Yeah, we are in a constant state of preparedness here at KU, and we are always ready for whatever comes through our doors.
I think that sounds great. Tanya?
Yeah, so totally agree with Annie. That's always our answer, I think. But also, making sure that you maintain that level of readiness and awareness in the community. As Dr. Hawkinson mentioned, there are so many different infectious diseases around the world. So being aware, especially as you travel and things of that nature, to where you're going and what precautions you can take.
And thanks to our demonstration team today as well. Casey, what is the takeaway for anyone watching?
I would have to say just education, don't be afraid. Infectious disease, it's out there, it's happening in the world, but what you can do is protect yourself and protect others around you.
Maggie?
I would absolutely agree with Casey. I think knowing reputable sources to get your information and collaborating with other folks that have specialty and additional education and training is always really helpful to make sure that you're getting good factual information.
And then our excellent guinea pig for today, Jordan, any final thoughts?
I hate to be repetitive, but the same as Annie and Tanya are saying, that just making sure that we are constantly ready for just the next thing to come, and making sure that we're educated and well prepared.
All right. Well, thank you again to all of you for being here today. Just like to have a couple final thoughts. An easy one is we are always interested in prevention. Prevention is always the best. So what can we do when we're talking about this topic particularly? Just be aware when you're outside. Wear long clothes, wear that insect repellent, help protect you from getting those tick bites and those mosquito bites. And I just want to thank my IPAC team, who is so good and been so wonderful. Everything from the leadership from Amanda Cackler and Lance Williamson down to the team on a day-to-day basis that works here at the University of Kansas Health System on so many aspects to help protect you and prevent other illnesses when you get here into the hospital, and of course help develop these systems and processes for when and if these infections and diseases do make it to our doors. So thank you again to all, and I hope you have a good, safe Wednesday, and make sure you stay cool as well.
Coming up Friday on the Morning Medical Update.
Have you ever heard of white bagging? No, it's not how some people bring their lunch to work. I'm Alexis Del Cid. On the next Morning Medical Update, we'll explain the top concerns around this insurance company practice that changes how some patients get critical infused or injected medications. Friday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.